One of the busiest men in the country joining us now, the Health Secretary Sajid Javid. Hello, thanks for joining us. Good morning. We really appreciate you taking the time.
Thank you for having me.
How many people a day do you want to vaccinate? How do they go about getting the jab? And will the centres be open through Christmas?
Well, thank you again for having me. Since we learned about Omicron, our strategy has been to buy time to assess it and to build our defences. What we now know about Omicron is that, first of all, that it's spreading at a phenomenal rate, something that we've never seen before. It's doubling every 2 to 3 days in infections, and that means we're facing a tidal wave of infection. We're once again in a race between the vaccine and the virus. The second thing that we now know for sure is that the vaccines, 2 doses are not enough, but 3 doses still provide excellent protection against symptomatic infection. And that's why the booster programme has become more important than ever. We've boosted more people than any other country in Europe already, but we now need to go on a new national mission, and that's what we're doing. That's what the Prime Minister announced yesterday. We are extending and opening the booster programme to all over 18, starting from today in walk-in centres. They can book for Wednesday to give them all a chance to get their booster shot before the new year. And the way we're going to do this is by expanding it to a level, the booster programme, that we've never seen before in terms of vaccination in this country. So we're going to have even more vaccination centres. We're going to open all vaccination centres 7 days a week for at least 12 hours a day, some for many, many longer than that, some even perhaps 24 hours. Over the Christmas holiday period.
They'll be open every day?
I'm not sure. I don't think they're going to open on Christmas Day at this point.
Every other day?
They'll be open. The current planning is to open them every other day.
A million people a day?
Well, let me tell you how we're going to do it.
Well, that's how many you'll need to vaccinate.
We'll have to look. The target is huge. Of course, it's a huge target.
What is the target?
The highest we've ever achieved before with the vaccination programme is around 770,000 in a day. Yeah, in terms of vaccinations.
540,000 with boosters.
UK, we've achieved 770,000 before. That's the highest in a single day in England before. And so to try to boost this many people, you're going to have to even beat that every single day. Now it's a phenomenal target and the phenomenal thing we want to do, but it will only work if, of course, we've got the capacity there, and that's why we're building this capacity, including different types of units, mobile units and pop-up units, asking GPs to do more and pharmacists to do even more. We've brought in 41 military planners covering every region in England to help with the logistics and the planning, working with all the fantastic people in there. We are throwing everything at it. And can I just please say this to your viewers, that please play your part. This could not be more important. We need to win this race against the growth of this virus. As I say, we've never seen this kind of growth before. So please do come forward, protect yourselves, your loved ones and your community.
Is it because AstraZeneca wasn't as good as we initially thought, and actually the booster, either Pfizer or Moderna, is what's helping?
No, I think that would be completely unfair. AstraZeneca has played a phenomenal role in protecting our country.
That's the accusation, so you're saying...
No, we remember we were one of the first countries in the world to start vaccinating. That has meant that we have slowly started. We saw this especially over the summer. We started opening up. We are still one of the most open countries, and because of the success of our vaccination programme. And AstraZeneca has played a phenomenal role. Okay. The difference now is this variant, and different types of vaccines will react in different ways. But whether it's AstraZeneca you had for your first 2 doses, or it's Pfizer or Moderna, you still need a booster shot to be protected against this new variant.
How many people are in hospital with Omicron this morning?
It's around 3,000 confirmed cases in England.
In hospital?
I'm sorry, I beg your pardon. I misunderstood your question. Cases is around 3,000. In England, there's about 10 people that are confirmed in England with Omicron.
How many are on ventilators?
I don't have the answer to that question. I don't know how ill they are in hospital.
How many have died?
At this point in time, I can't confirm a death. But just can I say that even with the...
You see where I'm going with this?
I absolutely do. And the key point is that first of all, if you remember when COVID first came to our shores, it arrived in January of 2020. We didn't have our first death until March, I believe. And the reason is because there's always a lag between infection and then hospitalisation, and then sadly death. There's always a lag, and that's what we're even in South Africa, where this variant started earlier. There's been a huge number of hospitalisations. They've been doubling.
That's levelled off already, though, hasn't it? And fewer people are now finding themselves on ventilators in South Africa, and even the Prime Minister or the President, who's sadly been confirmed with Omicron, he only has mild symptoms.
Well, there's a lot of talk about this might have, it might be less severe, so milder. The truth is, no one knows for sure at this point. It's very difficult to compare what's happening in South Africa to what might happen here. For example, differences in the age of the population, the different levels and types of immunity people have, how they gained that immunity. But it might we can't rule it out. It might be more milder than the Delta. But what the difference that there exists is that the growth rate is what's different. And so if it grows at such a phenomenal rate with a million, let's say 1 million infections at the current growth rate by the end of this month, even when a virus is mild, a small percentage of people from a very large number still can equal a high number of hospitalisations.
75,000 deaths by May is what the London School of Hygiene and Tropical Medicine is modelling. They have previously done modelling. They forecasted in April that we would suffer post-lockdown, predicted 750 to 1,000 deaths a day by the end of summer 2021. That actually resulted in something like 71 deaths a day. So how seriously can we take their figures?
Well, look, those are their figures, and
that's
they will.
Modelling on, isn't it?
No, it's not at all. Not at all. That's their figures. They don't work for the government. They're an independent group. We will get our own advice from the government's own scientists, and we listen carefully to that advice. And at the end of the day, as ministers, you have to take all this into account and understand the trade-offs, because when you do take action, like we've asked people to work from home from today, this has a big impact on people's lives. It's not just a distraction. It can be really difficult for people to be away from the office, not to have that social interaction. It can impact their life chances. So we wouldn't take this action lightly at all. So based on the advice that we're getting, but now also on the observed data, we do have 2 weeks of data where we are seeing this phenomenal growth in infections. It's already, we estimate, it's around 40% of infections in London already. And so because of this growth rate and what we now know of the vaccines, that's why we've announced this national mission on the booster programme.
Let me put this to you, if I may, please, Health Secretary. The Prime Minister said last night, he's put the fear of God in us. Do not make the mistake of thinking Omicron can't hurt you, can't make you and your loved ones seriously ill. That's what the Prime Minister said yesterday. You're telling me this morning we've only got a handful of people in hospital with, let me finish, with the Omicron. As far as you're aware, probably none of them on ventilators. Certainly nobody has died. We have been aware that this Omicron variant has been in the UK since October. So that gives us 3 months of data, and there have been no deaths.
Well, as I say, the Omicron has only taken hold in the UK in the last 3 weeks. It's already growing at a rate of doubling 2 to 3 times. Every 2 to 3 days, it's doubling. And we are, at that rate, you will have 1 million infections by the end of the month. And what that means is that even if the severity... So let's think of it this way, Kay, if I can explain it this way. With Delta, let's assume that of all the infections, around 2% of those people end up in hospital. With Omicron, with Omicron, let's assume it's half the severity. It's half the severity. Let's just half it. If it's 1% of a much larger number, you still end up in a lot of hospitalisations. And what the government could do, there's a couple of options here for any government,
been any deaths,
right?
Minister?
Well, there haven't been any deaths yet.
Yes, but we've known about it being in the UK since October. And
it's only
3 months, and there haven't been any deaths yet.
What matters is when community transmission starts, and that's only been actually probably 3 weeks at most in terms of community transmission. That's what we've started to see in this country. And if the government just sort of stuck its head in the sand and said, let's just wait and see what happens, let's wait for the deaths to happen, by then it would be too late. The infections, the growth rate for certainly the next couple of weeks would have been baked in, the doubling times for the next 3 or 4 doubling times would have been baked in. And then you'd have me here rightly saying, why didn't you act earlier? Why didn't you act earlier? Have you not learned any of the lessons about this virus? Have you not learned about how to try to protect people from it and to take action in advance? And you would have rightly have been able to ask me those questions.
OK.
But we've got to act early, and that's the reason to have this booster programme expand at the pace that we wanted to see it, and ask people to please come forward and to protect themselves.
OK.
It's the best way still to protect ourselves.
Given that it's here, are we going to lift South Africa off the red list?
We'll keep that under review, but as it spreads across the country, there's obviously less and less reason to put any country on a red list because of Omicron, but we are keeping it under review. OK,
let me talk to you about Downing Street and what's going on there, if I may. You were too upset to come in last week, weren't you? I understand that when you were looking at that video. How are you feeling about it now?
Well, it's being investigated. I'm pleased it's being investigated properly. It's being properly looked at.
Labour demanding that the Prime Minister answer questions in the Commons, not just about that video, but about a quiz that he hosted as well. Is that something that the government should comply with?
Well, look, I saw the photo of that quiz like anyone else. What I can see is it's a virtual quiz with the Prime Minister sitting at his desk. But again, the Prime Minister...
Who was he talking to on the quiz?
I think he's talking to some of his staff on a virtual quiz.
And where were they all? They were all in the same room. So, you know, it's duplicitous to say he was
I don't know all the details. What I can
should it be investigated?
What I can see is a virtual quiz, and Simon Case has been given a broad remit to investigate anything that he thinks that should be under any type of gathering in Downing Street that should be looked at on any particular day he wants to. And so if he wants to look at this, he will. That's going to be a decision for him. It's not right, I think, for a minister to tell him what he should or should not investigate. He would have seen that photo, I'm sure, himself. But let him do his job. And it's right that it's a cabinet secretary that does this, that's a civil servant, a senior civil servant, and that's the right way to try and establish all the facts.
But in order for that to have that investigation to have any credibility, it needs to report the start of Christmas, doesn't it?
Well,
it does. Otherwise, you're kicking the can down the road.
Well, I think Simon Case will determine for himself how long he needs to establish the facts and to look at the evidence. And I'm sure if he can publish it sooner rather than later, he will. There's no reason not to.
Whatever, the polling is poor as a direct result of what's been happening with the Prime Minister. How important is Thursday's by-election to the Prime Minister?
Look, every by-election is important. Of course, we want to win it. We're in there to fight for every vote. We're lucky we've got a fantastic candidate. Neil Shastri Hurst, he's worked in the NHS, he's worked in the army, and he's a fantastic candidate. And I'm sure anyone in Shropshire that meets him will like him. But ultimately, it's about fighting for every vote.
Yeah, the bookies, and as my dad always used to say, I've never seen a poor bookie, are saying the Lib Dems are going to win.
Well, let's see what actually happens.
What impact will that have on the Prime Minister and the respect that he has from the party if he loses?
Look,
given that
any party wants to win any election, whether you're in government or not. We want to win this election. We won one just recently, and we're going to work hard and fight for every vote.
We're out of time, but let me just ask you whether you saw Lewis Hamilton's race yesterday.
I did not. I didn't have the time. I did read about it. I just didn't have the time. I was working on expanding the booster programme.
Indeed. Are you an F1 fan?
I'm not normally, but I did watch it last week, and I really wanted to watch it this time. But
you should watch it back. It's an absolute outrage. Some might say, not that I've got any influence at all, but it was
I felt sorry for him. I'm a real fan of his. And also, by the way, he's just done a fantastic video with other Formula One players encouraging everyone to come forward and get vaccinated.
Good to talk to you. Thank you very much indeed. I know you've got a very busy schedule today. Thank you. And indeed, this side of the new year. Thank you.